Welcome to Active Points Wellness. My name is Warren Schick. Today we're going to be talking about a health tip, self-care tip to focus on shoulder and neck mobility, range of motion issues. And what I wanted to talk about a little bit before I start with the exercises, a lot of our daily activities now, routines of driving a car, or working on a computer, or texting, are all very sagittal plane, and we spend a lot of our day and time in this kind of what's called a upper crossed syndrome type of position, where shoulders migrate forward and chin migrates forward, so we get a lot of tightness, weakness through some musculature in and around the shoulder and neck, and then we get this hypertonicity, or this overworked, overstressed muscle tissue along the posterior part of the body, supporting the weight of the head, supporting the weight of the shoulders as they migrate forward. So we're going to try and work on our things to combat this, and the way you do that is through kind of a daily practice of some key exercises, very quick, but help to basically help your body correct the shortening that's going on in some of the anterior muscle groups, and help strengthen and retrain body position in other muscle groups. So what you're going to do is you're just going to work with the wall, and what you can do is if you have more mobility through the hips, you can stand with your feet directly underneath your shoulders. If you have more tightness and you tend to have more of this kind of anterior tilt, you're going to find that walking your feet just slightly forward of the floor gives yourself a little bit more flexibility to do these exercises. But what we're going to do is work on shoulder T, shoulder Y, and shoulder I. And what you're going to do is 6 repetitions of each position, and you're going to hold each for 6 seconds in a mild to moderate intensity level. So you don't want to try and push too hard, but you do want to engage and intentionally hold the position for a 6 or 8 second period. Okay, so first one is the shoulder T. So you're just going to relax your hands down by your thighs. You're going to bring your chin and chest, kind of raise this chest and pinch the shoulder blades. And then from here, we're going to bring the hands up to shoulder level. We're going to bring the elbows close to the wall, and then the hands are going to rotate back towards the wall. So we have the chin and the shoulder blades, the elbows, and then the hands. You can kind of just walk through this checklist, and you'll hold that position for 6 seconds, and then relax down, where you're lengthening the muscle and then shortening the muscle. So you bring the elbows back, the hands back, chin, and then engaging your core muscles or your abdominal muscles, holding for 6 and repeating. So you're going to go through that 6 times, and then you'll move to the second position, which is the Y position. So same kind of idea, you're thinking of the thumbs coming up and towards the wall in this Y directed position. So start again with the chin, shoulder blades, and then the hands. Reach. Hopefully you can touch the wall, but if you can't, you're just trying to engage in towards the wall. Hold that shortened position with the muscles in the back of the shoulder, and then release. And then perform again. Shoulder blades, chin, hands. Hold for 6, and then release. And again, you're going to perform that 6 times 6, just nice and easy, 6 repetitions of 6 seconds. And then your third position being the I position. So hands starting by the thighs again, bring the chin back, your shoulder blades back, and then raise the hands straight over top of the head with the thumbs pointing back, engage into the wall, shorten, hold for 6, and then release. Shoulder blades, chin, and then hands. And 6 seconds, and then release down. Performing 6 times 6 seconds. You want to do this on a regular basis. If you do this for 6 to 8 weeks, you'll see some definite notable change in your posture, and then the mobility and function of the shoulder joint improves, which takes some of the tension and work off of some of these other muscles to promote better mobility and function. Hope this helps, and we'll see you next time.